비디오 시작.
알겠습니다.
Good afternoon. My name is Bo Gi-pyun. I'm teaching at Morgan University in Daejeon. Actually, I'm interested in community social work. So today, I'm going to present my topic, which is related to community social work. As an introduction, I'm going to explain about the history of federal health start in US briefly and the result of implementation after some 30 years. Let's start. In 1991, Health Resource and Services Administration, under the supervision of Department of Health and Human Services, introduced federal health start to provide the service of maternity protection and children's health protection to need women and children living in urban and rural area where infant mortality rate was 1.5 times or 2 times of national average. Some 30 years later, after the implementation, Health Start is presently implemented nationwide, providing diverse services such as medical and health production service to local inhabitants who are relatively marginalized for race, gender, socio-economic status, and the residential area. The result of Health Start is not only to properly meet the necessity of local inhabitants, but also to ensure the principle of accessibility and comprehensiveness, integration, and equality of services by delivering integrative service to them through connection between local medical institution and home in relation to preventive service in comprehensive character as well as chronic disease. And the basic principle of a Health Start can be summarized as provision of innovative service, construction of cooperative system with community enhancement of service receivers' sense of responsibility, alliance with diverse local institutions, enhancement of effect and accessibility of service, and emphasis of education for local inhabitants. As I said above, this study intends to investigate the content and the result of Health Start and to check the problem of Korean local welfare system, which provides inefficient and discrete service on the basis of investigation and to present the improvement plan. Then I will explain the content of federal health start more concretely. First of all, let's see the components of Health Start. Health Start is composed of 4 factors. First factor is community consortium. HealthStart compose consortium with service receiver. It means client, local inhabitants, and service provider. The consortium intends not only to facilitate the evaluation of a HealthStart program, advocacy of problem, and communication among subject of organization with advice on local inhabitants' desire of health, but also to contribute to social and economic improvement through Health Start service. Second factor is local health system action plan. In the supporting stage, this action program is established, which compute to be chosen for Health Start program. Each entity which supports Health Start should present 5-year practice plan, which can be mitigate or improve factors that negatively affect maternity or children. Then, Health Start program should necessarily present standard, which can assess and evaluate structural and environmental disorder factors that affect the reduction of local infant mortality rate and birth of low-weight infant in delivery. Third factor is construction of cooperative relation with department in charge of health in the state government. Healthy Start program received the support of federal subsidy program. It is called state title FIPS. For local aid institution establishment, development of medical and health manpower, who are in charge of improvement of fertility care service before and after delivery, including maternity, mental health, through close relation with government department. First factor is establishment of maintenance plan of Healthy Start program. Healthy Start program established and plans which can constantly improve the service and draw specific practice program. For instance, comprehensive plan is established for stable maintenance of Healthy Start components, as budget is provided by state Medicare, or plan is established to conceive business for profit and to get economic support from federal government and the state government or private institution. So paragraph is services practices of Healthy Start program. There are 4 main service practical activities in federal Health Start. First activity is outreach and recruitment of clients. Outreach is usually composed of general servers, semi-expert and expert who are in charge of finding clients and planning or implementing participation. To this end, social marketing techniques is used to publicize service, and diverse access routes are developed so that objects may get service. Second activity is home visiting and case management. Home visiting and case management are significant service delivery means of HealthStart. Home visiting provides group education, service, and individual service through regulated intake process and assessment process. Third activity is health education for parents and other services. HealthStart implements health education in many areas so that pregnant women or child-breeding women may lead a normal life while bearing and raising children. Before training, clients are intensively trained on the content, which includes nursing, nutrition, pre-delivery care, prevention of disease and early detection, etc. First activity is depression test and request. HealthStart program includes test of depression. Sorry. These service providers are professionally trained on how to use total depression test and interpretation of test result. First paragraph is mixed service delivery model of HealthStart program. Mixed service delivery model is a kind of delivery model in which local general servers, semi-expert, and expert participate to attempt interdisciplinary approach by constructing cooperative system in order to provide not only healthcare service but also diverse social services. This model does not only provide pregnant delivery women and children with healthcare service, but provides service of child abuse prevention and intervention, parent education, family education, vocational training, and social psychological support service. The core delivery method of mixed service model is home visiting, which is mainly composed of servers, semi-experts, local health activities, and experts. Case management service provided through home visiting pays attention to environmental factors which negatively affect clients, especially promptly linking diverse support to solve object problem, enhancing intervention effect, and paying constant attention to object. It represents their position, forms mutual reliability, and their life. In this sense, the indispensable fact of home visit. Sorry. And fifth paragraph is present situation of local welfare system in Korea and implication of HealthStart to Korea. One of the phenomenon arising in relation to local welfare delivery system in Korea is disorderly establishment and competition of local welfare service delivery institutions and absence of local welfare cooperative construction system. One of the factors which affect such phenomenon can be said to be privatization of welfare service. And next problem or next situation is service consumer points out that service is centered on supplier, not on user, asserting the right of using service. Besides, it cannot be denied the reality that Community Assurance Council, which should play the role of adjusting welfare service in community, is formal and nominal. Thus, the most serious problem of local welfare delivery system in Korea is that networking, which coordinates and connects diverse social providers in the area, is quite meager. Namely, integrative service cannot be provided if operation and connection among service programs is meager. And I will try to suggest the implication of health start in US to Korea. First, demand-oriented integrative service delivery system should be urgently constructed by utilizing local resource based on cooperation and connection with the public and several private service providers in the community. Depending on situation, unification may be attempted by merging institutions, but administrative management costs may arise, causing several internal issues such as conflict over power, leadership problem, and budget. Thus, so coordination and connection among present institutions whose service delivery system are separated seems more appropriate. It should be overlooked that the inhabitants' participation should be ensured. In case the service design, service type, and delivery method are discussed and determined with inhabitants' participation. Participation can be more promoted and service effect may be also increased because service meeting inhabitants' necessity and desire may be provided. Checking the improvement plan of local welfare system in Korea in the aspect of system and service provision by referring to the contents of operation of health start. System needs to be reorganized first by enhancing networking among diverse service providers in the community. For instance, public institution or welfare service provider, For instance, public institution or welfare center in the community at the center of service providers in the community should coordinate and integrate service provided by each institution being in charge of finding and mobilizing resource and planning service program, and sharing information on resource availability, resource availability in the region and inhabitants' demographic property and desire by constructing cooperative system with basic local government. The local welfare center can support mutually supplementary service through local hospital, health center, family consultation center, family consultation center, child care center, etc. They may instruct, and train general servers, semi-experts, and experts who can provide the service by visiting home. At last, I would like to conclude my topic as follows. Investigating the HealthStart program, it is drawn the following implication for the development of local welfare delivery system in Korea, at present and in the future. To begin with, it is necessary to establish user-oriented, integrative social service delivery system by fully utilizing local resource through cooperation and connection between diverse public and private institutions which provide service in community. Sorry. Second, home visiting system should be introduced urgently. Teams should be composed mainly of community manpower to provide service which meet not only home but also characteristics and desire of community people. Then the efficiency, effect, as well as expertise of service can be enhanced, realizing high cost effectiveness. Third, it is required to debate and to determine design of service, character, and kinds of service, and its delivery method through local inhabitants' active participation. Then, empowerment formed by satisfying inhabitants' desire and participation make it easy to enhance and recover the control of situation client face, thereby leading to community change with the individual change. First, just like the financial support and the cooperative relation of federal government and the local government in each grade considerably affect the settlement and the local government in each. First, just like the financial support and the cooperation relation of federal government and the local government in each grade considerably affect the settlement and the expansion of a health start program. Administrative and financial support is required through close cooperation with the central government in relation to local service infrastructure amplification and reorganization of local welfare system. New serving providing mode. So that's all. Thank you for listening. 감사합니다.